This is our presentation on the Bot 2 test by Helbig and Macey Vasquez. So our agenda is what is Bot 2, who is our participant, what materials did we use, we'll go through our assessment, our results, and lastly our recommendations. So first, what is Bot 2? Bot 2 is a Bruin-Ostrowski test of motor proficiency for ages 4 to 21 years old. The purpose is performance measure, fine manual control, manual coordination, motor coordination, strength, and agility. Test items are fine motor precision, fine motor integration, manual dexterity, bilateral coordination, balance, running speed, and agility, upper limb coordination, as well as strength. And the validity and reliability of the values for individuals aged to 13-21, the subtest test retest reliability is adequate at ICC equals 0.69. For individuals aged 4 to 21, the inter-rater reliability is excellent at ICC equals 0.98. For individuals aged 11 to 16, the Bot 2 total motor composite has excellent convergent validity with the MABC 2 total test score, RHO equals 0.80, and P is less than 0.01. So, who uses Bot 2? Occupational and physical therapists use it for goal writing, to validate a need for therapy, compare to motor typical children, identify deficits, as well as track milestone completion. Our participant is Courtney. Her gender is female, her age is 20, and her ethnicity is white, and we use a stock photo in order to maintain her privacy. The materials with administration, easel, record forms. We did not use a balance beam, but we did use a bowl instead of a penny pad. We used a tennis ball and a basketball, and manual examinee booklets, scoring transparency pennies, and we used a pillow instead of a knee pad. Our assessment is the short form assessment. It measures the performance, and it contains 14 items. So the first one is the finer motor precision. This is drawing lines through paths. This is the crooked version, and there are no errors. Next one is folding paper. So we can see that our participant is folding along those lines and is able to follow that as they fold through the paper. They're using both their hands to do so. And once again, they are following the lines. That is the end for that test. Next is fine motor integration. So they copied the square and there are no errors on that one. For the next one is copying the star, and there are a few errors that we will see in the results. The next is transferring pennies. So they transfer 20 pennies into the bowl within 15 seconds. Next is jumping in place, same side synchronized. Participants able to do that while keeping both their body sides synchronized. Next is tapping feet and fingers, same side synchronized as well. We can see their feet under the table, tapping at the same time as their fingers. Next is walking forward on a line. We use the line within the grout of the tile to go along. And they're able to do this without falling or taking their hands off their hips or going off the line. Next is standing on one leg. We did not have the balance beam, but we did make sure that they did not move along the tiles. And kept that leg at 90 degrees and their eyes open. Next is one leg stationary hop. So they continue to keep that leg at 90 degrees, hands on hips, and they did 25 hops. Then dropping and catching a ball. They were able to drop and catch the ball without having to catch it within their hands and their body. And they did 5 of those. Next is dribbling the ball, alternating hands. As you see, that was done. Next is knee push-ups. For this one, we used a pillow instead of the knee pad. They will do this keeping their shoulders and hips in line without dropping either. We can see the participant continues with the push-ups and does all the ones needed for the test without changing their alignment or falling. Next is sit-ups. So once again, the participant is able to do these without coming out of alignment. These are our results. So our subtest item for drawing lines through paths, as you saw in the assessment, our raw score was 0, there were no errors, and total point score was 7. For folding paper, our raw score was 12, total point score 7. Copying a square, it was 5 and 5. Copying a star, we did have a few errors, and that was 3 and 3. For transferring pennies, that was 20 and 9. For jumping in place same side, that was 5 and 3. Tapping feet and fingers, that was 10-4. Walking forward on line, we got 6-4. Standing on one leg, no beam, that was 10-4. One leg stationary hops, that was 50-10. Dropping and catching a ball was 5-5. Dribbling a ball was 10-7. Knee push-ups was 36-9. And sit-ups was 36-9 as well. So overall, for our results, our total motor composite, our percentile is 99th. Total point score was 86, our stand score was 72, our confidence was 90%, our band value was plus or minus 6, our confidence interval was 66 to 78, and our descriptive category was well above average. For interpretation, it was well above average motor proficiency. Compared to Bot 2 manual norms, Courtney's performance places her in the superior range, consistent with her daily dance training. Strengths was balanced by lateral coordination, agility, and endurance. This was seen in sit-ups, push-ups, hopping, and balance beam. Fine motor dexterity was seen within the pennies and folding paper. Our relative growth areas are upper limb coordination tasks, ball catching, dribbling, slightly lower percentile compared to balance strength, and still above average, but could be improved across training sports or hand-eye drills because those are not things that she normally does. So recommendations for coordinated Kenyon in her dance training to focus on maintaining balance and coordination strengths while adding structures, strength conditioning around at her motor profile. Leverage strengths, use balance coordination skills, explore advanced choreography, incorporate agility and improvisation performance, target growth areas, strength training to complement endurance, and cross train 3 times a week with sports or Pilates to further enhance core stability. And daily life application may be to maintain injury prevention routines. So this could be continuing with her stretching, her warm-ups, and her cool-downs, just to keep from not gaining injuries so that none of these scores will go down. And lastly, these are references. So we used the manual or booklet for this, as well as a journal from the Scandinavian Occupational Therapy. And that is the end of our presentation.